Last night, Republicans in the House successfully passed their budget resolution with a margin of 217 to 215. Only one Republican voted against it, Thomas Massie, and he was arguing for deficit reasons, and we're going to talk about that in a video next week. But I want to go into what exactly this budget resolution calls for in regards to health care for Americans. In the Energy and Commerce Committee, they are tasked with a massive hurdle. They need to cut $880 billion over the next decade from their committee. So Ben, what does this committee oversee?
This committee oversees about $25 trillion worth of spending total over the next 10 years. And about 98% of that is made up of Medicare and Medicaid, which means that there is no way that this $880 billion can come out without massive cuts to one of those two programs. And where we are is that it's obviously going to be Medicaid.
Yeah.
I guess it's kind of interesting that we assume that we know that.
You know what it is? Americans don't look at poor people as a protected class the same way they look at probably retirees or elderly people as a protected class.
Sure.
So I think the political capital of gutting programs that assist poor people is a lot easier to do.
Yes.
Right?
I agree. Specifically the Republican Party, probably, at least historically, even if a large portion of Donald Trump's voting base in this recent election was from the working class.
And I want to call out something quick because there were a lot of Republicans that said that they would not vote for a budget resolution if it cut Medicaid. They all lied. All of them lied.
Well, here is where we need to be careful.
Yeah, this is where it gets difficult here because no matter what, in order to cut $880 billion out of this committee, which they have to do to go through with the budget reconciliation process.
They have to do if the Trump tax cuts are going to be extended. That is the caveat that I wanted to give.
Yeah, so let me give this too. For the budget resolution to be successful and for them to go through a budget reconciliation process, which again, it's in a video that we've done previously, and I'm not going to go into the whole process here. It needs to follow the budget resolution to a T. There cannot be differences in a bill later on. So this bill calls for $800 billion worth of cuts. If they do not go through with that many amount of cuts, then the entire bill falls apart and the tax cuts do not happen.
Yes.
Okay?
Yes.
So a lot of Republicans are probably biding their time who say they don't want to cut Medicaid, and they're going to let this process play out, and they're going to wait to see how exactly this committee actually goes ahead and plans to cut Medicaid. Because we know they have to if they want the Trump tax cuts to pass. It's all about how they're going to do that. And they have a few options on how to reach this $880 billion mark. The first one, which I think will be the easiest for them, even if it is devastating, is putting on work requirements for people to get access to Medicaid. This is something a lot of states have tried to do in the past, and a lot of them have not been successful. And I want to go out with that right away because in the 90s, we had this move towards work requirements for welfare. And during the 90s, when the economy was booming, everyone thought the reforms were so perfect. But then when the recession hit with the great with the dot-com bubble burst, all these people got left screwed over because the fault of being unemployed is not a moral failing on the person or a piece of laziness on the person.
Correct.
Normally, it's economic effects.
Yes.
And so other Republican states have tried to do this. Arkansas is a big one. Arkansas put work requirements on Medicaid. They received a waiver from the federal government to try this out. They did not see any employment effects at all from tying work requirements to Medicaid. It did not increase employment at all.
So it just kicks people off of their health care.
It just kicks people off of that health care. Why? I think it's pretty reasonable. You don't work if you're not healthy. And if you're not healthy, it's really hard to go get work, and you can't get health insurance. And so these people are left between a rock and a hard place, and this is one area where I think Republicans are going to very easily come together and say, no, I am comfortable screwing over the unemployed.
Yes.
I think every Republican is going to be like, okay, if you're unemployed,
fuck
you.
This is totally aligned with their entire ideology, right?
Yeah.
It makes all the sense in the world. The problem is just how little it cuts.
That is, yes.
Right? Because it's only supposed to save them $100 billion over the course of 10 years. again, 100 billion out of the 880 billion. So that's the low hanging fruit.
Mm-hmm.
But then they have to start to go reach deeper into the tree.
Yes.
And that's when you start to get to things specifically that are much bigger chunks, like pulling back the Affordable Care Act expansion of Medicaid.
And this is devastating, right? A lot of Republican and red states never would have expanded Medicaid to cover more people if the federal government did not give them an incentive to do so with increased funding. It wouldn't have happened. Montana, I think like North Dakota, these states wouldn't have done it. If the Republicans decide to pull this back, red rural states are going to get hit hard with this.
Yes. I mean, all of the enrollees in the Affordable Care Act expansion part of Medicaid are going to get hit hard. We made a video about this again last week where we were talking about how the premiums are going to increase from 200 to 300%.
Yes, because the Affordable Care Act subsidies are not a tax incentive that the Republicans are looking to expand.
Mm-hmm. Yeah.
So, yeah.
It's just going to take, it's going to disincentivize the use of healthcare, which is going to make people less healthy, which is going to weigh on the economy in and of itself because people are going to be less able to work, but also it's going to weigh on the economy by removing all of that purchasing power, consumption power from the economy.
And all the healthcare jobs that have gone into beefing up rural hospitals that are being funded through Medicaid are going to start closing. And so you can see the cascading effect happening here.
Mm-hmm.
And then that doesn't, even if you do both those things, that doesn't get you to 880 billion yet. Even that doesn't do it.
No.
And so then they have to go even deeper. And then this is the one that I think that this one fundamentally changes what Medicaid is. They want to change, currently, for every dollar a state spends on Medicaid, the federal government gives them a specific match on that dollar. It's not 1-to-1. They give them a certain percentage for each dollar spent.
Mm-hmm.
They want to change that. And Republicans want to change that to only be a per capita block grant for each individual.
Yeah.
And what that means is that states, if inflationary spirals happen, if the cost of care goes up, if there's a nursing shortage and they have to increase costs, if they have to increase Medicaid payouts, the federal government will not be there to assist with that rising cost.
Mm-hmm.
They will only assist with increased enrollment, not with increasing costs by higher wages for nurses or anything else that may happen.
Yes, and so the fallout here, right? So we tried to dig kind of deep into this before we recorded this because a long time ago, right when we started the show, like one of our first episodes, we did a deep dive into healthcare, health insurance systems. We looked at a bunch of foreign countries which have systems that are way, way more efficient than ours, normally because they have universal health care, government-provided universal health insurance as some part of their program. And I remembered, like, one of the things we looked into, one of the things we learned about was called a capitated system. And so I was like, okay, capitated system. They're thinking about a per capita block grant. Is there any similarity here? Turns out there is. So part of the capitated system of these foreign governments, of these foreign universal healthcare programs, is to, again, allocate an amount of money for each patient that is served at one of these hospitals or doctor's offices to cover their health care for the year. The difference, and this is where, like, seeing where this bill nets out is going to be extremely important. Mm-hmm. Like, the nitty gritty here is going to matter a lot. The difference is that in these foreign countries, the general practitioner care is what's covered by this block grant. So you don't have to worry about variable costs that much when you're thinking about just like the twice a year checkup that someone's going to get, right? You don't have to worry about, oh, if I give, I don't know how much it costs, $1,000 for each person to get checked up twice a year, or $500 or whatever it is. There's not really a chance that like maybe inflation is kind of higher that year, but you're not going to get blown out of the water. Right?
You're not going to get blown out of the water.
Yes.
Where in this Republican plan, you can get blown out of the water.
Because if you have someone who suddenly gets cancer or any kind of other rare disease, or they get in a car accident and they need an ambulance to take them to a hospital, an ambulance ride costs like $16,000 in the U.S. That's where you start to get really exposed. And these states, and particularly, again, these poorer red states are going to be ones that are like, oh, fuck, we don't have the money to step in for this, especially as the government, because right now the federal government is matching them somewhat on a dollar for dollar. It's not necessarily dollar for dollar. Sometimes, most of the time, on average, the federal government spends more than the states on Medicaid. But now it's like they're not matching us in any way. Like as these costs go up, we are completely liable. So they're going to have to pull way back as far as what the states are offering.
States are going to be totally incentivized to reduce their Medicaid payouts and reduce what they cover through Medicaid.
Yes.
Which is only going to hurt poor people more and more. And, you know, it's interesting because Republicans have expanded their base of support into these rural, poor populations that used to be members of the Democratic Party. And one of the reasons was because Donald Trump ran on this populist platform that talked about, okay, the immigrants are screwing you over, but I'm not gonna, you know? And so now...
he's like, I'm the one defending you. I'm the one standing between you and them.
And all of a sudden, he is directly, you know, I shouldn't say all of a sudden, but right off the bat of his presidency, he's going right for the jugular of the poorest and most vulnerable people in our country who voted for him. And it's so devastating to watch. And, you know, a lot of the blue states, they're going to have to pull back on services, of course, because they spend more per capita per person because we provide better care and it's more expensive here in a state like Massachusetts. But Massachusetts is a liberal state. We'll figure it out. We'll increase taxes.
The state will step up.
The state will step up.
Yeah.
That's not going to happen in North Dakota or Montana. You're just going to lose care.
Yes.
And people are going to die. 14 million people are going to lose health insurance in the first year of this.
Yes, people. I do. So I don't know. I think we are, for good reason, very worried about what's going to happen here. I am really curious to see if this happens. If something like a per capita block grant comes out, and say the states decide, like, okay, we're gonna like 30% of this we're going to give to cover general practitioner care. Right. And so everyone gets a certain amount of general practitioner care, and we're going to hope that the rest of the 70 covers as much of the variable care as we need it to. I am curious to see whether we get more efficiency in terms of like dollars spent per medical care outcome. I'm doubtful, and a big reason why I'm doubtful is what we learned about when we did our healthcare deep dive is that a ton of the cost in the U.S. healthcare system goes to administration. And that administration is necessary specifically because we don't have a big enough, simple enough universal healthcare system. So like take the UK. The UK has a government-provided health insurance system. They also have private health insurers for certain individuals who can who might benefit because of their specific conditions, their situations. They have costs, healthcare costs, that are way lower than ours because of the monopsony power, the buyer power that government health insurer has. And that also is it reduces the need for all this administration because so many people in the population, such a big percentage of the population, is on that government-provided program. The changes to this structure of Medicaid that we're talking about is not going to reduce the complexity of our system at all. You're still going to have mostly private insurers covering people. You're going to need all of this administration. And
you know what?
I don't think it's going to help.
Republicans also plan on increasing the administration because another way that they want to go about cutting Medicaid is increasing the amount of times a person has to check in and make sure that their income is eligible to receive the Medicaid benefits. So during the Biden administration said you're only allowed to check people's incomes a certain number of times each decade in order to see if they're eligible for Medicaid. Now, right off the bat, you might think, well, that's bullshit. They shouldn't receive it unless their income is at a certain level. And I understand that, and I respect that, and that's fine. However, if you do not, if you look and try to get people's incomes every single year, every 6 months, every 3 months, this is paperwork that people now have to file. People have to read that paperwork. That costs money. That costs money in and of itself. And when you're increasing this overhead, it also reduces the amount of poor people who are then going to have the resources and wherewithal to know when these new enrollment times are.
That's the main thing. They're just not going to do it.
They're just not going to do it.
They're just not going to do it. And that evidence of that has come up with like federal programs that have a lot of bureaucracy and paperwork all the time. So I feel like if a yearly check that happens automatically based on the income, the tax
Totally
return,
reasonable.
right? That makes all the sense in the world.
Totally reasonable.
Because at least on the surface, ideologically or hypothetically, it makes sense to be like, yeah, again, they get the Medicaid if their income qualifies them for it.
Yeah.
I have no problem with that.
Totally.
The problem, like you're saying, is just the process that it takes to actually get that information.
If the federal government built an automatic income checking system with the IRS,
yes,
plugged into every Medicaid office, and it's an automatic thing,
yes,
yeah, like I'm cool with that. Like,
totally.
that makes perfect sense.
Totally. That's the type of thing where it is like, okay, this Trump is always spewing his bullshit about like fraud and waste being everywhere,
right?
Yes, and this is where like, okay, we're actually getting to a part of the government where no, there's a little bit of a point here, right? Like we can, yes, I am not opposed to government efficiency on its face.
Yep.
Right?
Exactly.
So I'm down for something like that.
And now I got to go into this last part. This is a long video, guys. We don't put out videos like this very often anymore.
Fuck it.
The Republicans are liars. And it's I don't know how they're going to go about doing this from a legislative perspective.
Okay.
There are Republicans in the Senate like Josh Hawley who said today, like, I'm not cutting Medicaid.
Really?
Yeah.
He said today?
Yeah, like today, like a couple minutes ago. He's like,
wow.
the Senate is going to make a lot of changes to this bill.
Okay.
You know? And then the House has to go back and approve those changes. And then the Senate has to go back, and if the House made more changes, then the Senate has to approve the changes that the House made.
Yes. Well, okay.
And so the reconciliation process cannot go forward until both chambers have the exact same budget resolution. And Medicaid is going to be a huge sticking point. Josh Hawley's like, I'm not cutting Medicaid.
Well, this is where, again, you started this by saying Republicans are liars. Maybe Josh Hawley and other Republicans who think the same as him in the Senate actually put their foot down and they have enough sway to change this. So let's say we expect them to be liars because Donald Trump has already put like his political weight into getting this version of it passed.
Yeah.
So it's hard to imagine that it doesn't get through the Senate with that.
And Republicans in the House have already lied. A ton of Republicans in the House said, I'm not cutting Medicaid. And then they vote for this.
Yes.
And it's an $880 billion cut to the Energy and Commerce Committee. And you're like, but they only oversee Medicaid and Medicare.
Yes.
What do you mean?
Yes.
And like, we're only looking at the waste, fraud, and abuse. And it's like, okay, well, even if you put work requirements on everybody, you only save $1 billion. And if you want to consider that waste, then there's your waste.
But this is where we have, like, I want us to maintain integrity with our words, right? Because they're at least going to try to dance around it with, it's a restructuring of Medicaid.
Yeah.
And this is how we're making it more efficient by restructuring it. And it will lead to the effective cuts.
Yeah.
Right?
Of 14 million people in the first year.
Exactly. But they're going to argue that it is not exactly cutting Medicaid.
I think that's slimy and bold.
Oh, it's totally slimy.
Okay,
yes.
Good.
I also disagree with it, but we just need to cover our bases because we talked again before this video of like there's a way that the amount that is spent like per treatment or whatever doesn't actually change at all, even if it is shifted to this per capita system, because it disincentivizes consumers of healthcare so much that what the state and federal government covers is actually the same as it would otherwise on a percentage basis.
Right, because it's possible people just seek care less often.
Exactly.
So they do get sicker, but the state saves money.
Exactly. So we just need to be clear about like, yeah, people will get sicker, healthcare will decline. Like we're going to have, our population will be worse off.
Life expectancy goes down in rural America.
Yes.
But the state will save money.
Yes. And the senators and congressmen kind of weasel their way around this direct lie of we're cutting spending on Medicaid. We're cutting Medicaid.
We'll see what happens over the next month. It's going to be a long 3-month process for this.